number 5, the Honourable Annette King.
Thank you, Mr Speaker. My question is to the Minister of Health.
Order, order, order. Honourable Annette King, question number 5.
My questions to the Minister of Health. Are patients getting access to publicly funded health services as prescribed by their health professionals? If not, why not?
The Honourable Dr Jonathan Coleman.
Mr Speaker, yes. For example, in the last year we've completed 88,000 elective day surgery procedures, filled 43 million prescriptions and seen and treated over 1 million people in our emergency departments. But there's always more we can do, and that's why we're implementing further initiatives such as the Mobility Action Teams, which will work with community health providers to better diagnose and manage musculoskeletal conditions. Our ability to treat more patients comes from the government's ever-increasing health budget, which now stands at almost $16 billion annually, a $4.1 billion increase since 2008.
Supplementary
question, the Honourable Annette King.
If patients are getting access to the health services they need with the additional money being put in, why has the Auckland DHB lifted the threshold at which patients can get hip and knee replacement surgery from 50 points in June 2012 to 70 points in June 2015?
The Honourable Dr Jonathan Coleman.
Well, Mr Speaker, the DHB has an ever-increasing budget. I mean, in Auckland it's gone up $1.248 billion over the last 7 years, and they're also doing more operations all the time. So over the last 7 years, they've increased their annual elective discharge output by nearly 5,000 operations per year. There's always more we can do, and the DHB has to decide how best it allocates the funds to deliver the services which it thinks appropriate.
Leave them in more pain.
Point of order, Mr Speaker.
Point of order, the Honourable Annette King.
The question asked was
Order.
why
I
are they
listened to
lifting
the question,
threshold?
and the member was right until the very end of the answer. The member may not have been. The question was not answered at the initial part, without doubt, but at the very end, the Minister did answer the question. Or address the question.
Point of order, Mr Speaker.
Point of order, the Honourable Annette
I
King.
seek leave to table an official information request from Auckland DHB setting out that the points for getting hip and knee is 50 points. That's dated December 2013. The second one is an official information request dated the 20th of August 2015, saying it has been lifted to 70 points.
Leave sought to table those two documents. Is there any objection? There is none. They can be tabled.
Supplementary question,
Supplementary question, the Honourable Annette King.
Why have 13 of the 20 DHBs lifted the threshold at which patients can get hip and knee surgery since June 2012, including counties Manukau, Hawke's Bay, Waikato, right down to the West Coast, Nelson, Marlborough and South Canterbury?
The Honourable Dr Jonathan Coleman.
Mr Speaker, because each year they have to decide how they best allocate the funds that they do have, but overall they're doing an extra 50,000 operations more than they were 7 years ago.
Supplementary question.
Supplementary question, the Honourable Annette King.
Has he seen correspondence sent to patients who are denied orthopaedic surgery, even though they are in considerable pain, which states that they're being adversely affected by funding limitations? If so, why does he keep denying there is a serious problem with access to surgery for thousands of New Zealanders?
Either of those two supplementary
Speaker,
questions,
I
the
think I'm
Honourable
aware
Dr
of the
Jonathan Coleman.
specific letter she's talking about from a Hawke's Bay surgeon, but the fact is there's always more we can do, and that's why we are doing more. That's why we are doing an extra 50,000 operations a year, an extra 60,000 appointments for surgical appointments, and also an extra 60,000 medical appointments on top of that.
Supplementary question.
Supplementary question, the Honourable Annette King.
If patients are able to access public health services they desperately need, why have more than 650 appeals been started by patients, their families and friends this year alone, begging for money because they've got nowhere else to turn to get help for their health problems?
The Honourable Dr Jonathan Coleman.
Mr Speaker, right throughout history we have not been able to give every patient every treatment that they would like. It happened under the Labor government, and it's a factor in all medical systems throughout the Western world. The fact is, though, the answer to unmet need is to do more, and we are doing more all the time. If you look at pharmaceuticals, we are funding more. More New Zealanders are getting access to the medicines they need, and we're doing more all the time. That is the answer.
Supplementary question, Barbara Stewart.
Thank you, Mr Speaker. Are health patients in Auckland getting appropriate access to emergency health services when Auckland DHB emergency departments have been at or above full capacity for 8 out of 10 days so far during 2015, and if so, why?
The Honourable Dr Jonathan Coleman.
Yes.
Point of order, Mr Speaker.
Point of order, Barbara Stewart.
I seek leave to table an OIA request from Auckland DHB dated 7 October 2015 outlining exactly how many days that Auckland Emergency Departments...
Order. The document's been well described in light of the question. Leave us sought to table that particular OIA. Is there any objection? There is none. It can be tabled. Question.